And TTT Live online on Facebook. I'm Dike Rostant with a COVID-19 review. The number of positive cases of COVID-19 in Trinidad and Tobago continues to hold steady at 116, with the last positive case reported on April 26. According to the Ministry of Health's daily clinical update, the total number of persons discharged has been 103. Now, one person remains in the high dependency unit at the Couva Hospital. There are 4 people at the step-down facility in the home of football in Couva. They are all said to be in low risk and stable conditions. The ministry says a total of 2,153 tests have been submitted for COVID-19 testing. 332 of those were repeated tests, and we're told all the community tests so far have come back negative. 69 nationals who returned from Suriname last week Friday are still in quarantine in Debe. Moving on to future plans for data gathered, the Ministry of Health will begin a series of studies on the coronavirus and its impact on Trinidad and Tobago. At Thursday's Ministry of Health COVID-19 media briefing, Health Minister Terence Dialsing said, given the current availability of clinical data, the ministry will be seeking to improve its understanding of the virus so as to better prepare this government and future administrations' responses to similar emergencies.
What that will do is to help us make plans for the future. It will help us now consider the new symptomology that is presenting itself across the world. One of the newest symptomologies, and the Chief Medical Officer will expand on it, and I'm just raising it here, is something called silent hypoxia. You would have heard last week and 2 weeks ago, new symptoms presenting loss of taste, loss of smell.
Collected thus far must not go to waste.
The Ministry of Health is going to be very proactive by doing this retrospective study of 116 cases so that when we prepare for future developments, we will have a model not only for COVID, but a model as to how future ministers of health, ministries of health, future governments can deal with pandemics.
So it's Thursday, that means we are linking with TTAP, and in our mental health moment today, we see ourselves discussing children and adolescents as well as teenage grief and loss with Dr. Margaret Nakhid-Chatoor, Clinical and Educational Psychologist. She is the immediate past president of the TT, or Trinidad and Tobago Association of Psychologists, assistant professor at UTT in Psychology and Education, and has worked with children, teenagers, and their families locally and abroad for more than 25 years. So we say good afternoon, Dr. Nakhid-Chatoor. Hoping that you can hear us at this point in time, Dr. Nakhid-Chatoor.
Hi, are you hearing me?
Yes, we can. So
all right, good afternoon.
Good afternoon. I also want to apologize to our viewers in advance if we have phone issues, since Dr. Nakhid-Chatoor's number is one of those featured on TTAP's website. And let me ask you, Doctor, how has that been thus far?
Oh, it has been something else. I mean, every day calls, and many persons of late calling in about children, and very interestingly about adult children. So it has been really active. And I want to say, especially since we're talking about children and adolescents, remember that in any crisis, in any natural disaster, a pandemic, children are the most vulnerable because they are the ones who depend on their parents, depend on adults for guidance to provide for them. And one of the things I mentioned to you, DK, so far in this pandemic, I felt that the narrative was targeted to a specific group of persons, whether it was lower middle and upper income. And this, we hear all of the directives given by the Ministry of Health. We hear those directives given by the Ministry of Education for online learning. And it targets a particular group of persons with homes, with water, electricity, laptops, computer, those persons who may already have their fridges stocked with supplies, etc. And parents who are at home, parents who are comfortable working with their children. But I am a little bit concerned about those families with children, with teenagers who are off the grid, who are below the poverty line. And this is not something that is happening because of COVID. So if we just step back a little bit and look at what was happening before COVID, many of these homes were characterized by joblessness, by families who are in poverty, abuse, domestic violence, malnutrition, hunger. So that COVID, this pandemic, I think has exacerbated this issue. Before COVID, it was a human rights issue because there are many gaps in this society that have not targeted that. So during COVID, it is more of a human rights issues where in these homes with children, with teenagers, sometimes they are unable to provide even one meal per day. Parents who survive from day-to-day living, having jobs to depend on, who don't even have fridges to stock food. And so when we talk about children and adolescents, I do not want us to forget this group of children who I believe without our foot soldiers, without people knowing where they are, will not be given the necessary assistance that they have.
Now, if we jump onto Maslow's hierarchy of needs and we're saying, okay, well, it's a human rights issue, there are physical needs that need to be supplied, sated, dealt with. How do we treat with the psychological aspects of that while there's so much physical need?
All right, so I think that this pandemic would push some of those households to turn to desperate measures to survive. Children, I think, in those households would face an increased risk of abuse, possibly exploitation. And I would really love to see what would happen because even before COVID, we had families in desperation marrying off their children at early ages and stages. So some of the mental health effects of this would, of course, have to come within those homes. How are the parents surviving? How are they coping? Because as you know, Dike, children would watch their parents for psychological cues. They would watch their parents for examples of stress. Children know their parents more than parents sometimes know themselves. So if these psychological cues are telling children that it is a violent atmosphere, parents are without a job, they're becoming very volatile, children would pick up on these cues and do a few things. Very young children, they might regress in behaviors, they might have nightmares, they might suck their thumbs. Adolescents tend to withdraw at these times when a situation is volatile, when they cannot understand something. Many of them would withdraw. They would possibly become aggressive. They may revert to very risky behaviors to cope.
And what are some of the other ways that the sense of self can be affected? I say that because birds of a feather flock together. You can tell a lot about me by my circle and the people that I'm with. Circles or the opportunity for people to have that sort of community is now restricted. With that happening, who am I? How do I get my sense of self? How do I function? How do I treat with that?
Correct. Because remember, this is a unique kind of pandemic where parents are now the first line responders in their homes for children's survival, for their care. We don't have the church, we don't have the schools, socialization agencies that helped out the family. So now parents not only have to do the informal learning, but we are being told that they have to provide formal learning experiences for their children, help them with all these online experiences, learning, e-tools, etc. So you can imagine that these homes could be very tense, where parents don't know where to turn for their support. Children in these homes who were accustomed to having that extra adult to talk to, the teacher, maybe the pastor, having breakfast and lunch in schools, having maybe a teacher to tell of abuse, a teacher to tell about certain things, having a friend, maybe to teenagers like to talk to their friends about what's happening with them. This is no longer there. So parents now have to deal with the formal and informal learning of their children as first line responders. And I think many times we forget this here, so that if we are to talk about helping children survive, we first have to reach their parents to provide support to them, to give them encouragement, to give them parenting cues during this time. Because I think that this pandemic is a unique opportunity for people to do things differently, for our society to do things differently, for us to get back to the collective, the community, watching out for your neighbor. Because let me tell you, DK, where parents and children are concerned, someone always knows what's happening in homes. Someone always knows, whether it's a neighbor, a family member, they always know where the homes are that children are in need, that children are being abused. And I think there has to be a national call for things to happen. If we talk about what can we do, let's say, for children and teenagers in homes like these, I think that our emergency responses need possibly to drop food off of these homes, especially in these homes where there may be pregnant women and young children. Now that brings us to an issue that I have with what is happening now as Trinidad and Tobago's response to families in need. If we had, let's say, a data or a grid.
Okay, we actually lose.
I think it would give our social workers and our soldiers a better idea, so they don't have to go searching. They don't already know where these homes are, where the need is. And perhaps post-COVID, that is something that we can put in place to respond, because we cannot forget that part of our population who are below the poverty line, who are 30% illiterate, and who may not necessarily know where to avail themselves of opportunities.
But Dr. Nakhid-Chatoor, we have less than a minute left. So I want to quickly try to get some thoughts on you on teenagers, adolescents coping with grief and loss at this time. It may not be physical, but I had something, I was able to do something. I'm not able to do it right now.
Yes. This especially now, children are under the management of their parents. But where teenagers are concerned, this is a time for them where there's a lot of grief, a lot of loss. Many of them are mourning the social interaction with their friends, because we know teenagers are social beings. They want the parties, the movies, hanging out at the malls, any place except home. Home is not the place to be for a lot of teenagers. They may love their families, but many of them prefer the company of their friends more. So I think parents need to listen to their teenagers at this time, understand that this is a trying time for them. Many of them had planned their graduations, hoping to finish exams, hoping to graduate, leave school, go to universities. This can no longer happen in their to-do list. So we have to be understanding. We have to give them the opportunity to talk. We have to reach teenagers at their level, not at ours. Have the patience and the tolerance to listen to them, even though we may not agree with their viewpoints. Ensure that they have healthy routines. What helps teenagers a lot is structure, routine. Have that, set that in place for them, so at least they could feel a sense of control when they get up in the morning and a sense of accomplishment at the end of the day. Make sure that they're eating healthy, make sure that they have a balanced diet, and they are not engaging in risky behaviors. This is a time where teenagers, because of lack of that social support, they may want to try behaviors. Vaping, smoking, maybe the alcohol in the cabinet that the parent has. You have to be on the alert for this. You have to watch out for these risky behaviors, because this is not a time for experimentation, especially when COVID-19, as we know, attacks the immune system, and adolescents could well compromise not only their physical health, but their mental health.
And we thank you very much, Dr. Nakhid-Chatoor. This has been a mental health moment, and a mental health moment, it really feels very short in truth and in fact. But our next installment will be on Monday, where we are carded to discuss relationship issues, all types, dealing with abuse behind closed doors. And moving forward, that is what is trending on COVID-19. Now remember, you can join us for live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, as well as on Facebook at TTT Live Online for all your COVID-19 updates. Thank you for joining us. On behalf of the TTT crew, I'm Dike Rostant. Bye for now.